Hi, I'm Pooja, and this is Mom to Mom OB, where real women talk to real doctors about the issues concerning them. Today's video is going to be about inductions. This is part of our childbirth series, and I hope to answer the question, what if I don't go into labor? And a lot of women don't. I didn't go into labor. I got to 39 weeks and was tired of being pregnant and hadn't gone into labor yet. And so I want to talk to you guys about what options are available to women who get to their due date or get, within a couple days of their due date and end up going for an induction instead of spontaneous labor. So an induction of labor is the process of artificially stimulating labor in a woman to achieve a vaginal delivery. And that's the goal. More and more often, women who have high-risk pregnancies or additional risks that would be a contraindication to going past 39 weeks are being offered induction. So that they get the optimal benefits of gestating to a term delivery, but then don't take on any additional risks from going past their due date. So inductions can be started by a variety of methods. Most often, they require some sort of cervical ripening. And we talked about ripening, or sort of this pre-labor phase of labor that occurs before or during the latent phase. Basically, the cervix needs to become soft, pliable, stretchy, and thin. So if we're going to artificially initiate that process, we can use either a balloon, a Foley balloon, which is a water-filled latex or non-latex balloon that's inflated and sits just against the cervix between the fetal head and the cervix. So it provides this weight, this little spherical weight on the cervix. And just with the force of gravity, or sometimes with traction, you can tape it to the leg and have a little bit of stretch to the rubber, to the latex. And that little bit of traction and the weight of the water-filled balloon will cause the cervix to slowly stretch, thin out, and dilate. Another option is to use a medication. So misoprostol is a little pill. A piece of that pill could be placed against the cervix in the vagina and cause a release of chemical factors that cause a cascade of hormones and chemicals to be released that sort of initiate the process of the cervix becoming thin and soft. And then there are inserts with a similar medication called Cervidil. There's also Pitocin, which is an IV medication that stimulates the contractions, and just with the fetal head sitting on the cervix and the force of the contractions, sometimes that's enough to get the cervix to start dilating. Once the cervix has started to dilate and is, 2 or 3 centimeters, then Pitocin is typically continued or initiated or switched out for whatever ripening agent you were using before. And then those rhythmic, powerful contractions that indicate active labor are hopefully stimulated with the Pitocin. And that is what achieves the 6 to 10 centimeters dilation, or that period of active labor. As the cervix dilates further and you transition to active labor, sometimes the body will take on the labor process on its own. And sometimes once the Pitocin is initiated, it doesn't really need to be increased. Other times it does have to be increased from the initial dose up to a level that will produce the strength of contractions that you need. Ways to monitor your labor during induction include external monitors that we talked about before, monitors that sit on the maternal abdomen and measure the frequency of contractions, and also ones that monitor the baby's heart rate. And there are internal monitors that are actually measuring the pressure generated by each contraction. And so those types of monitors can be used to titrate the level of Pitocin to achieve the perfect regular, powerful contraction that your body needs to produce cervical change and get you to the second stage and ultimately to delivery. So that is my discussion of induction of labor. And please leave any questions or comments that you might have below, and I'll take time to answer them. Thank you so much for joining us, and we look forward to talking to you next time.